Some of the earliest evidence of cancer is found among fossilized bone tumors, human mummies in ancient Egypt, and ancient manuscripts. Growths suggestive of the bone cancer called osteosarcoma have been seen in mummies. Bony skull destruction as seen in cancer of the head and neck has been found too. The origin of the word cancer is credited to the Greek physician Hippocrates, who is considered the father of medicine. Cancer was once called crabs because that was the shape of the tumor.
Diagnosis. There are several ways to diagnose the chondrosarcoma. One option is a biopsy, which is when they remove tissue with a needle or via surgery to scrutinize under a microscope. X-rays make images of internal organs and show the tissues. CAT scans are a more detailed version of an X-ray. MRIs use magnets, radio frequency, and computers to show detailed images of organs and structures. PET scan is glucose injected into the bloodstream and a scanning machine that determines if any tissue are using too much glucose to identify a tumor. This is a biopsy. This is an X-ray. This is a CAT scan. This is an MRI. And that's a PET scan.
Treatment. Specific treatment for chondrosarcoma will be determined by your healthcare provider based on your age, overall health, medical history, type, stage, and location of the cancer. Your tolerance for specific medicines, procedures, and therapies, expectation for the course of the disease, your opinion or preference. The goal for treatment of chondrosarcoma is to remove the mass and reduce the likelihood that it will return. Close follow-up with your healthcare provider may be necessary. Further treatment may include surgery, physical therapy, radiation therapy, or chemotherapy.
At what point are you cured? In a complete remission, all signs and symptoms of cancer have disappeared. Sorry about that. If you remain in complete remission for 5 years or more, some doctors may say that you are cured. Still, some cancer cells can remain in your body for many years after treatment. I'm back. Future issues and side effects. If you have received or actively receiving certain cancer therapies, you may be at an increased risk of developing osteoporosis. Osteoporosis and osteopenia, the precursor to osteoporosis, are medical terms for decreases in bone density or a thinning or weakening of the bones. This increases the risk of fracture, breakage of the bones.
Prevention. There is no way to prevent chondrosarcoma. People with uncommon bone-related conditions may be more likely to develop chondrosarcoma. Also, some scientists have noted a connection between chondrosarcoma and injury to the affected area. However, they do not know whether the trauma triggers the cancer or simply draws attention to an undetected cancer.
Conclusion. Chondrosarcoma has been around for a long time. There are several ways to diagnose it. Unfortunately, treatment isn't, or fortunately, not unfortunately, treatment is an option. The point of being cured is slightly iffy, but it is possible. If the cancer is absent from the body for longer than 5 years, then most doctors consider it cured. Unfortunately, there's no way to prevent the disease. There's also the possibility that it will come back eventually.
Thank you.
You.